Welcome back, folks, to episode 82 of the Running Man Self-Regulation Skills Project podcast with me, your host, Dr. Armando Dominguez, PhD in health psychology, licensed professional counselor, and an adjunct professor at a local community college. And what our discussion topic is going to be today is going to be speaking the language of the body. And the language of the body is something that whenever we are considering working with trauma, pain, or even getting somebody to get physically motivated to be able to do things, we have to understand that not only do we encourage people to, let's say, be better performers or keep the eye on the ball, this sort of thing, but we're giving people verbal descriptors and proscriptions and instructions on how to do things. And there's nothing wrong with that. However, whenever we are trying to actually make change occur in the body, we're expecting our body to make an interpretation based on what we're thinking, interpreting the words that we hear that are instructions if we're learning a new skill. And this is getting back to the levels of learning, and that is going from unconscious incompetence, progressing through conscious competence to mastery at some point where you're unconsciously competent. And those are incredible ideas to work through. But whenever we have, let's say, a memory that is uncomfortable and we've become anxious or panicky, or maybe we realize we respond to things or hyper respond to things, or maybe even under respond to things, whether they be socially or something personal or even private for that matter, or even if we are experiencing something that would be considered dangerous or threatening, but yet there's a response that would be atypical or abnormal or maybe even unhealthy for that matter. This is when we start realizing that we feel first. And back in 2010 is whenever we actually recognized that the body feels before we start to have cognition at the highest level, decision-making process. At the prefrontal cortical level, the highest part of our brain that makes the most complex of our thinking happen. And even though we may have measured with fMRI and realized that it's our feeling that come online beforehand, observationally for many thousands of years, even practitioners of meditation, yoga, and the Platonic thinkers back in Grecian times, ancient Grecian times, that we historically consider the hotbed for our growth in Socratic reasoning and philosophy, by observation we knew that the nature of man was that man, human, not excluding women, also that we feel and that we observe before we ever get to the point where we start having higher thinking and reasoning, and that under duress or stress, that our higher thinking and reasoning is compromised, very simply. So, what is the language of the body is the question, and why is this so important to self-regulatory skills? And I will tell you that I have for many years taught self-regulation based on managing arousal, and I've taught it to not only my martial arts students and also myself. I've practiced these methodologies, but recognizing that the stressors that we experience physically are environmental threats, these sort of things that could bring damage or danger to our organism, or even an anticipated or expected sense of danger if we know that we're in a situation that is dangerous, or that something that could become suddenly violent, or something that could compromise our organism to where we could get hurt or killed, or even someone else could be, then we get very uncomfortable. We get tense, heart rate goes up, breathing changes, and we become hyper focused on it, or we become very hyper focused on finding a way out, a point of egress. And those are very healthy, normal things. Now, the language of the body is not just one, but rather it is founded in the fact that we have multiple nerve pathways that lead into our lower parts of our brain that are autonomic. So these are like programs. That is our software that is very much lined up with the very hardware that has to do with immediate safety and organismic survival that we would call closer to spinal reflexes. And I have very fortunately found a resource. I found this at the library today, and I'm just so beside myself in excitement because this book is called The Secret Language of the Body. And it has much of what it is that I've been trying to teach people for many years. And a lot of therapists have gotten on board with trying to teach the physiology of the body relative to stress and trying to couple that with cognitive behavioral therapy. Dialectical behavioral therapy now is using these self-awareness, physiological self-awareness tools for people that have, such as like personality disorders, this sort of thing, where the impulsivity and the quickness of change in behavior occurs because of prior trauma. And these things happen so fast that often they get interpreted, sometimes misinterpreted, incorrectly interpreted, as character defect or moral ethical failing, when in actuality it's not that at all. What it is, it's a hyperarousal that is so fast that if we take somebody's survival self personality, in quotes, if you will, and put it in a typical social situation, that could be one where somebody could be judged or someone could be rejected. And we take into consideration that more so in females, we tend to hear this, but actually with males as well. And I'm not underplaying one or the other, but I'm just kind of giving you the gist of the trend in understanding in the colloquial and the out and about. Everybody doesn't know the depths of psychological structure in humans and behavior and stuff like that. But many people are of the opinion that women tend to be the ones that respond most badly to rejection. That's not necessarily so. But there is an arousal that goes up because a long time ago, when we were cave people, if we were part of a tribe, if you got rejected, male or female, that means you were out. If you were an apex predator, part of the tribe, and you were the spearhead whenever we're hunting this sort of thing, and you were the lead mom or female in the group, but yet you were shunned because of a mistake or because of an opinion, gossip once again, and gossip is a very ugly thing sometimes. And sometimes having a grapevine is healthy within an organization to get information across, but can also be very damaging. But in the sense that rejection could occur, if someone was rejected in those times, then you were out and about and you no longer had a number one emblazoned on your chest, so to speak, but rather you have a very glowing six in the back that is gathering attention from those things that would prey upon you because you don't have extra eyes around you to keep you safe when there were safety in numbers. So we are all very wired and sensitive to rejection, social rejection. And the language of the body is such that if there is along the lines of severe personality disorder, it is these things that we feel like we're going to lose attention when in actuality the personality that's shaped by environment or is formed in the environment is one that is survival oriented. How do I get what I need? And if we zip this backwards in time to when we were small and didn't know any better, we learned how to read body language. We knew whenever, if there were parents that were abusive or people that were abusive in situations that were of the rearing nature when we're small, and we relied upon certain adults, big people, to provide us what we needed: food, water, shelter, safety, and didn't want to get hurt. We learned not to do these things that would trigger those behaviors or those potential trauma-inducing behaviors. And we learned how to be basically an actor or an actress to survive. We had to learn how to put on the social camouflage, so to speak. And back to this book, The Secret Language of the Body, these are the things that we learn how to pay attention to, those unctions, those deep-seated neurological feelings and senses that we get whenever we have the heart rate go up because we perceive an environment to be dangerous, whenever in actuality there may not be anything dangerous out there. But if there's something that reminds you of a prior uncomfortable or dangerous situation, that's enough. And that is a guilt by association thing in the environment, in that if that's close enough, then that's enough reason to get hyper aroused, to start revving our engine, so to speak, and get ready to run if we're not running already. And that creates things that look like avoidant behavior or acting socially adroit such that you're untouchable, wherever we're actually, in a sense, trying to dissociate by not being there, by not allowing our personality to be there or being mindful or in a sense present, because we're trying to figure out where we're at and trying not to be there because it's uncomfortable. So those are some things that could possibly occur. I'm not saying they perfectly occur this way. You get the picture, but the point is that the secret language of the body is that the sensorium that we take in from our, what we talked about in the last podcast, the VACOG, the visual, auditory, kinesthetic, olfactory, and gustation, all of those senses that we take in information with are the things that are informing us moment to moment how we're needing to be to survive better and make it into the next right now. So we're really stuck in this moment to moment consciousness that can become very painful when we can't get out of it. But this also kind of robs us of blood flow to the front part of the brain, the running man model of stress, where we discuss how when our heart rate goes up, breathing goes up, our skeletal muscles by default become the priority because I should be moving, I should be running, I should be fighting, climbing, or anything along those lines. The mating and feeding falls away from the 4Fs or the 4.5 Fs. We could freeze if we get overly stimulated and we are stuck in our mind thinking about what we need to do, and we're at that visual level. And this is a very proto preparation thing, but whenever we can't get our body to move based on what we're thinking, we're in that freeze response, and that's incredibly painful. And then we have the guilt and shame that comes because I wasn't strong enough, wasn't fast enough, couldn't avoid. Why didn't I do something? All of these things we're stuck with. So it's a very painful realization after the fact if we survive it. Now, here's the thing whenever we have the secret language of the body, the language of the body. There are several aspects of that language. We have our visual language, we have our olfactory language, we have our kinesthetic language based on our tactile touch sensitivity. We have our gustation, what we taste and we smell that inform us once again, moment to moment, how we need to be. And it can be any of those things that can trigger a memory or reaction based on a memory or a past event. And if we keep this in mind, we understand that the language that we speak in therapy, for instance, whenever we have someone talking to us and we're trying to talk to someone and we try to ask them, do you get it? You get it? And it's like, no, I don't get it. And it's not so much that we don't understand and we might feel dumb by trying to express that, but it's that we're trying to express in the manner that we usually understand, and that is language. And language is a useful tool, absolutely useful. It's incredibly helpful whenever we develop rapport, but we have to understand that rapport is not strictly lexical, verbal, spoken language. It is also our body language. And we understand that body language is 50% of any one message that is delivered. And even if it's spoken body language first, the delivery system is our body and how our person is behaving when they're speaking to us or delivering the message, even if it's a letter for that matter. That is one of the precursors to being able to trust whatever it is that is the message that is being spoken or shared or given to us. Secondarily, 43% of the influence in any one message or communication is tonal. If it is spoken, body language primary, secondary, tonal, what's it sound like? And do those two things match? We start wondering, can I trust this? This all happens in fractions of a moment. And then finally, the 7% that's left out of that 100% of any one message delivered is the verbiage or the code. If someone's handing you a card and they don't speak it, but the body language does not match what it is that's being put on that card that they want you to read, for instance, then you're not going to trust that, especially if they're rude and they thrust it at you as if you're supposed to accept it. And that might be enough to turn you off to no matter what it is saying, even if it's you won the lottery, you're not going to trust that if it's delivered in an ugly manner or an abrupt or manner that is threatening or makes you feel unsafe. So in this sense, using the theater of the mind by drawing up that mental picture, so to speak, we kind of get an idea as to what the language of the body is. And it's not always how we behave on the outside, but we have the language of the body spoken that occurs endogenously within. We have in our environment from the skin out, and then we have the environment from the skin, and the external environment involves what's called exteroception. And those are the perceptions that we receive or inform our body with as to how to respond at the physiological level. We're not even talking about the thinking yet, but yet our body responds to threat or something that smells threatening, could be a skunk, something that tastes threatening could be poison, or could be something that's tainted that might cause us to react within our cerebellum, where we have the area postrema that makes us vomit, because if we eat tainted food, we could very well die from food poisoning. And when we were cave people, their cave doctors were pretty thin on the ground at the time. So that would increase our chances of survival. So we had to be very sensitive to environment, even to those unspoken messages given by environment. Now, I know that I've painted this picture in the paleo sense, and it is very important to what it is we experience, because whenever we have once again, back to the person that may be coming from a history of abuse or neglect or trauma, this sort of thing. And when we see people act in a way that does not fit the social paradigm, then we may understand that it may be a trauma driven behavior, and therefore it can be rude, it could be loud, it could be clumsy, it could be completely avoidant, or you just may not see him there at all if it's something that can be predicted or avoided or is known to be occurring. And this is kind of akin to stage fright or being able to speak in public. Some people have a hard time with this, and we get very similar responses. But this is, of course, of a more intense and deeper level that is tied to things that are more dangerous than public speaking, for instance. And I'm not minimizing that because that is a real, true fear for many. Now, I'm going to give the title of this book again of the authors, and that is The Secret Language of the Body. And it says, subtitle, Regulate Your Nervous System, Heal Your Body, Free Your Mind, written by Jennifer Mann and Carden Rabin. And I will tell you that they did an incredible job in setting this book up, and that shows you not only what it is that is being experienced in pretty simple layman's terms without getting into huge neurological and psychological jargon, but also it's a very practical, showing you what to do, tactical what to do, and also the aspect of the tactical when to do it as far as what to do with these methodologies. And they're very simple. It's more so an awareness than actual just things to do. And there are a couple exercises that you do, but I'm going to tell you a little bit about the somatosensory system that they wrote. Bessel van der Kolk wrote the book, The Body Keeps the Score. And one of the quotes in here is, one of the clearest lessons from contemporary neuroscience is that our sense of ourselves is anchored in a vital connection with our bodies. So this is really important in that what we consider ourselves is based on not only our perceptions, but how we behave based on how we interpret our environment and also how we interpret the signals to that environment. So this is our self moment to moment. And they also mention that there's this one gentleman that developed this body modality called Somatics. And Thomas Hanna wrote the book Somatics. I got it many years back. And I went through all the exercises. They look kind of like some modified yoga stretches, not anything really difficult, but it helped one become aware and embodied of not only how one moved structurally, but also how the muscles tense and relax based on the amount of tension we carry. That was based on really the assumption that we have of how our environment is. Is our environment dangerous? Is it safe? Can I navigate it successfully? And can I survive well within it? And much of the things that I learned is that it did carry a lot of tension in shoulders and in my hips and back. Part of it was due to the fact that I was working in some pretty dangerous situations with individuals that were dangerous. And that put my psoas muscle at fault for much of the tension I felt in my lower back. And it didn't just fire alone. Of course, your hip flexors and that whole complex there gets tense, and they don't fire individually and alone, but the psoas muscle can get incredibly strong and therefore cause back pain. And I remembered experiencing that. And it wasn't due necessarily at that time due to lifting excessively, but something to think about. But he coined the term somatics. And what he said, and this is the quote from the book that is really fascinating, and I still remember reading this. So I was really impressed with this book because it had this in there. It says, the human body is not an instrument to be used, but a realm of one's being to be experienced, explored, enriched, and thereby educated. And this is really telling because we're looking at our body like a vehicle, yes, and there's nothing wrong with that idea, really. But it kind of smacks of Descartes' idea, that Descartes' error, that we are the ghost in the machine, kind of taking it for a ride, so to speak. And when we're done, we can park it and get into the Lamborghini, right? Wish I had one of those, but not so much. But the idea is still that there's this mind-body separation. But what Hannah talked about, that in somatics, there's an embodiment, but also an education of not only how well we do in our lives, but how we adapt to it. And they also mentioned a couple other things in this book. And it says here, and it's the principles of embodied awareness and movement developed by Hannah, as well as Wilhelm Reich, Moshe Feldenkrais, Emily Conrad, of who we spoke about in the book Life on Land, and Frederick Alexander from Alexander Method, and many more. And I would add Ida Rolf as well, her body work methodology I've used, got a complete series of that by the blessing of a good friend that saved my back. But Rolfing is another that is an embodiment kind of not only movement but also almost like a massage. And we'll talk. Well, it is massage no less, but things to keep in mind, and they make up the bedrock rather of contemporary nervous system regulation practices and trauma therapies. So these are the things that help us get over the perpetual tension that we have because our body is always considering environment not only stressful but potentially traumatic. And if we've been hurt once, we're afraid of getting hurt again, which that's only wise, wouldn't you say? But there are a couple of things that I wanted to talk about. She mentions in here interruption. And interruption, the authors, not just she, but they mention interruption. Sometimes whenever we have a negative response to something that we would call a traumatic response or anxiety or panic, if we realize that it's based on a memory, we know that whenever we remember anything, we do not remember with perfect 100% fidelity. We always remember it slightly different than the time before. So at the very end of the last time I've remembered versus the first time I experienced that event and the recollection of it, the first memory, we realize that we don't remember things with 100% fidelity. We talk about people having photographic memories. That is incorrect. There are some people that are very detail oriented and some a little less so. But there's inaccuracy in the way we re-represent the memory. So we never truly relive the event. What we wind up having is a very compelling memory that triggers our response. That's the hyperreactivity, the heart rate increase, and the stress, like the Running Man model talks about. But also, we are remembering it now at a distance, but also we tend to be hyper-focused on the details that seem to be the most pertinent and prominent to our immediate survival within the event. And if somebody else were there or having seen it, they may not have gotten the same. They may remember different parts. It may not have been traumatic to them. But if it's an individual traumatic event, it can be very terrifying to say the least. And also something that kind of rips the life out of somebody's life, in quotes, such that they feel like they're just walking on eggshells and avoiding things and not being around things. And it seems like they limit what they can live through or experience because of the fear of that reactivity coming up or something feeling unsafe. And many people complain about having agoraphobia, public anxiety, being out in the stores and only going in the evenings when there are fewer people to minimize what they have to experience as far as discomfort because they know it's coming on. And often they live lives of quiet desperation in the truest sense because that desperation stems from that survival panic that comes up. But what really is fascinating about this book, and we'll come to a close here in just a moment, is that it discusses polyvagal theory. And it's important to note that we have our primary spinal cord neurological structure for everything that we do, and that's our dorsum or our dorsal area. Like if we had a shark dorsal fin, it would be on our spine or our back. And then we have our ventral region that has to do with our abdomen, all our soft underbelly, so to speak. And the polyvagal theory discusses the ventral vagus structure having to do with the front. So these are the nerves that if somebody, and there are many people that know this that work in the medical field, we're to have somebody that has a quadriplegia or paraplegia from that point down, that the injury occurred that severed the spinal cord. Now the spinal cord is no longer transmitting along the length of it within the spinal column itself. But there are peripheral nerves as well, and these peripheral nerves are the vagal nerves that occur ventrally more centrally, such that they don't go down the middle of the spine. So if it's within the torso itself, that means that these nerves still transmit signal. And there are those men that are still able to get sexually aroused and father children after having been spinally injured, that they cannot move their own arms and legs because the signal goes out, but it has no way to return because of that broken spine. It can't even go out at that point. But what keeps the autonomics up is the vagus nerve. That has to do with organismic survival even after that spinal cord is broken. So we have the ventral and the dorsal structures with the vagus nerve that are also interacting with the body and still sending alternate signals. So there's a lot of potential there. In the next podcast, we're going to be discussing a little bit about dreams and lucid dreaming relative to visualization and healing. And these are some really important points having to do with what we're discussing today, because um, we can even use that to learn how to overcome those things that are traumatic to us. And I will tell you that just understanding that our vagal nerves will continue to activate whenever we're in survival mode, and learning where those areas are activating, either at the survival level, the social level, this sort of thing, knowing that we can parasympathetically cool our jets, so to speak. And we do have another alternative pathway to overcome the physiology of the stress that we experience when we're under the most stress. And there's definitely a boatload of symptomology that it's identified here. There's some great tools in the book, but I will tell you, it was just a great joy for me to find this book today, because it is a resource and I want to share it with y'all. And I think the authors of these book understand that you don't have to go to a therapist to be able to get benefit. I'm not telling you don't go to therapy if you need it, but what I am, and I am a licensed counselor, mind you, but at some point, talk therapy stops working. And at some point, we have to do something that is embodied. And the body work therapies that I mentioned, the Rolfing, Feldenkrais Method. Emily Conrad has since passed, and Moshe Feldenkrais has as well. So has Ida Rolf, but they have left many practitioners, and I encourage you to seek those out, because the only way does not exist, but there are many ways to be able to create not only relief, but improvement and survival, so that way we can thrive and win in this life by being above ground, sucking wind, and not just merely existing, but actually being able to enjoy what it is that we call our life. And I want to tell you, thank you for your time. I certainly enjoyed that. And we have another podcast coming up soon. And we'll be discussing more of the lucid dreaming stuff, because it does play a pertinent role in self-regulatory skills. And I just want to share this today. And these folks are actually bringing the tide in, so that way it raises all ships. And I'm one, and I know y'all are too. Share this with people that you think might benefit. And once again, iTunes has transcripts, so that way if you know anyone that may be hearing impaired that could benefit from this podcast, please share it with them. I would love for you to do that. And if you'd like to reach out to me, please send me an email at runningmangetskillsproject@gmail. I'd love to hear from you. And tell me where you're from, how you're doing, and let me know if there's something else you'd like me to talk about. There are many things I'm still going to be researching and discussing, but I'd love to hear what you think you'd like to hear, and I'd love to talk to you about those things. And do the best you can. Take care of yourself, and among other things, be kind to each other and walk well.